Thank you so much again for being here, everyone. Thank you so much, Dr. Daraz, for your time and just the efforts that you put into putting this presentation together so that we can learn more about how we can empower communities in our roles as information professionals in health literacy. Just to give some background about Dr. Daraz, she is a assistant professor and implementation scientist at the School of Library and Information Science at the University of Montreal. She served as an assistant professor of medicine and a research fellow at the Mayo Clinic in Rochester, Minnesota. Her expertise spans evidence-based practice, knowledge translation, digital health literacy, health informatics, and implementation science. And she's currently developing interventions to combat health misinformation and disinformation on the web.
Thank you so much, Rona, for the wonderful, introduction. And hello, everyone. First of all, thank you for the ASIS San Jose State University Student Chapter for this wonderful invitation. So today, very briefly, I want to discuss about the importance of health literacy and how, as an information professionals, we can contribute in improving health literacy for diverse population in our community. Okay. So before I start, I would like to start with showing a video. I hope you love it. This is given by Dr. Lisa Fitzpatrick, excuse me. I may say a French word now and then because I'm in a French university, French province, so I'm learning French. So if you hear some word in French, my apologies. So let me see if the video plays and if you can see and hear it. It's an wonderful video, so I hope you'll enjoy it. So I'm just going to go back a little bit just to introduce myself formally before I get into my actual discussion about health literacy. So as Rona mentioned, I am an assistant professor and an implementation scientist, but I came to Canada very early. I was very young, so I did all of my education actually in Canada. My undergraduate was in information technology from York University. And following that, I went to University of Toronto to do my master's in information studies. Back in these days, they used to call this program information studies, and now I think they changed it to information science. So this is the program. I wanted to talk about this because when I was doing my master's in information studies at UFT, this is when my interest grew in health literacy, and this was back in 2006, right? I started in 2004 and I finished in 2006, and I took a reading course in health literacy. And when I was reading the literature and research, and I saw there's a huge gap in literacy. Okay, especially for diverse population among vulnerable population, and there is a research gap in this area, especially the interventions to help people access reliable health information. So from there, so I wanted to, instead of becoming an information professional, I wanted to contribute in research. So I went to McMaster University to do my doctorate in health sciences. Here, in my doctorate program, I focused on my research topic was, information needs and preferences of people living with fibromyalgia, because this is one of the health condition that is not very well recognized by the healthcare system. There is no proper diagnosis and treatment. So the people living with fibromyalgia, they have tremendous need for health information to self-manage their condition. So this is where everything changed for my, career trajectory, what I'm doing today since then. So I was very lucky enough to get mentors at McMaster University in knowledge translation, implementation science. So after I finished my doctorate, I did my first postdoc at McMaster University in Department of Psychiatry and Neurosciences. And my research focused on community service providers for women with substance abuse issues and their children. And we developed intervention for community service providers for these women so that they can be evidence-based in their practice. From there, I went to USA, Mayo Clinic, so Mayo Clinic has an evidence-based practice research program, so that you know, all of you are from USA. So there are 13, if I am correct, there are 13 evidence-based practice program research center in USA. One is in Canada, rest of them are in USA. I would, if you have interest in evidence-based practice or research or evidence-based information, research, you should maybe communicate with one of the centers and maybe get some training from there. It's an amazing program. So I went to Mayo Clinic, this EPC center, as a research fellow, and from there, after I believe 1 or 2 years, I was promoted to be an assistant professor of medicine in the Mayo Clinic College of Medicine and Sciences. So I contributed in many things. I could talk about it hours. I really enjoy my time at Mayo Clinic. I was leading a major systematic reviews and meta-analysis. I also led the development of clinical practice guidelines, for example, for sickle cell disease. I also was, like a co-developer, and we taught we had a team in implementation science. So the first time we developed a course in dissemination and implementation science for clinician scientists. At Mayo Clinic, the course is still being offered. So it's basically, the course was developed for, their clinician scientists at Mayo Clinic. So I'm sure you know about Mayo Clinic. So there are 3 branches. The main branch for Mayo Clinic is patient care, and then they have the big branch in research, and then Mayo has their own School of Medicine, right? So I was contributing in the course development there, and also I developed patient training curriculum and implemented it. So why I mention it, because as you can see, my education, like, my undergraduate, my master's in information science, and then I did my doctorate, and I saw the value of, and the skills and knowledge you gain from information science program. You can really take it to in many places. I became an interdisciplinary researcher because, because I saw the value of the skills I learned from my information studies program, master's program, and I took it to McMaster to do my doctorate. And, when I was doing my doctorate in health sciences, I had no idea, because my undergraduate was not in health sciences. So it was almost like it's a new planet for me. So I took the time to learn the vocabulary in health sciences. And as you see, my PhD was in rehabilitation science. It's more difficult, right? But again, I saw the value, the knowledge that I can bring into the health sciences program, and how I could contribute. So as you can see, so my career trajectory took me to many places, and I contributed, and I learned from every places I went. Okay, so Mayo Clinic, I was there for until 2020, and then I basically, so all of these years, the knowledge and skills I gained, I wanted to bring back to information science. And probably that information science, is becoming more interdisciplinary. So you will see more and more courses being offered in health information science. That's what I'm doing right now in my current position. So from Mayo Clinic, I came to University of Montreal during pandemic, and become an assistant professor. I'm very fortunate enough to have the flexibility of introducing new courses in health information science. So I'm teaching courses in health information science. One is advanced health information research, and another one is health information behavior of different users in different contexts. So those are 2 new courses I'm teaching. Is the first time being offered in an information science program, and I'm very happy for it. And what I have noticed over the last 4 years I'm here, the students who took these 2 courses, so all of them, they changed their career, becoming maybe a librarian in a public library, or in a regular information center. So they have all become like either in a health sciences librarian in an academic library, or in a hospital, or or in a I don't know, I mean, health center, research center. So I'm very happy about that. If you want to know more about this, I'll be happy to discuss this further with you. So as Rona mentioned, that my research is, as you have as I have mentioned, that I have seen a huge research gap in health literacy and interventions and tools for, especially for lay people, to help them access reliable health information, both online and offline. But my research mainly focused on online platforms. I have received several grants from Canadian federal government and provincial government. We are developing interventions, some tools. Unfortunately, I'm not presenting them today, but Rona knows a little bit about it. But if you want to get involved with my work, feel free to reach out to me after the presentation. But what we are doing, we're developing tools for patients, caregivers, and general consumers. So when they go online to access health information, so they will use this user-friendly evidence-based tool to evaluate. They'll be able to self-evaluate the quality of online health information. And as you know that you do not, to improve health literacy, digital health literacy, you have to change behavior for both consumers and the information providers. And so I'm also developing a policy framework or guideline for online health information providers. For example, Facebook, Twitter, other platforms where huge dissemination of misinformation, especially during COVID-19. All of us have seen the dissemination of misinformation, disinformation, and conspiracy theory, right? So we need some guidelines. So I'm also developing some guidelines for health information providers, especially online. So that's about me. So now I want to move on to start with some statistics. Let's start with where you are in the USA. So as you can see, the numbers are really alarming. Only 12% adults in USA has competency in health literacy, and 77 million adults who have basic level of health literacy. Okay, and 9 out of 10 adults struggle with health literacy. So it's really, really a warning sign. And how is this impacting? Is impacting the US healthcare system, as Dr. Lisa mentioned, that low health literacy cost the US healthcare system between 106 to 238 billion per year. Let's see about Canada. It's almost like similar picture. In Canada, 88% seniors are not health literate, so they cannot interpret health information that are given to them by healthcare providers or online anywhere, or somebody else, maybe family, friends, or peers. And 12 million working as Canadians, they lack the minimum level of health literacy. Again, it means that they are not able to understand the health information given to them by different healthcare providers. And this is obvious that the Canadians, or it's the same for Americans. The people with lowest literacy skills have poor health, but in Canada, it's 3 times more than those with the highest skill. And in Canada, low health literacy costs $9 billion per year. So this is very, I give you this number. So as health future, health professionals, you should remember these numbers, and then just start thinking about it. How can you contribute to reduce this huge cost to our healthcare system, so that this money can be used for the improving patient care. And I must say, these numbers, in USA, this was in 2007, this number, and I'm like 200% confident that after COVID-19, this number, like I'm talking about the health literacy costs, have gone really, really up. I was not able to find a new number, but there are studies coming out slowly, like what was the cost in health literacy during COVID-19, after COVID-19. As you know that because the nature of the pandemic, everybody was online accessing for health information. This is just very quickly, just to show you. Again, it's difficult to find I was not able to find for USA, but This is again, it's old, but it still is the same. I think the numbers are not really. It doesn't look very good today, but this is the health literacy. Health literacy in Canada by province, as you see all of the province on the left hand side, and level 1 is the. I will go through each of the level, but level 1 is the lowest. Level 4 is the highest. So as you can see, we are between, right, level 2 and level 1, and a lot of people fall in level 1. It's not very good in Canada. Again, this is, I was able to find from in New York. It's a very 2 minutes video, and it's very interesting. So I just thought I'll share with you, so you know that the level of health literacy among general public in USA. So what you heard from the video is is consistent with the research that the doctors do not communicate well. And this is one of the major reason for why the general public, the patients, caregiver, the members of the public, they have a low level of health literacy. Okay. So what is health literacy? So there are many definition, but I try to select a few for you. So this was from CDC. So personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And there is another definition, organizational health literacy, which is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. And I was able to find another from Canada, from the Canadian Public Health Agency. The definition is the ability to access, comprehend, evaluate, and communicate information as a way to promote, maintain, and improve health in a variety of settings across the life's course. I really like this definition because I find this definition is more complete, because it's really talk about each aspect of health literacy. So it's the ability to access and then comprehend, understand, and then evaluate. This is very important. Health information could be bad, not reliable, right? So it's also the ability, a person's ability to evaluate if this is a good health information or bad health information, and then communicate that information in a way so they can promote and maintain their own health to improve health outcomes. So here you go, the level of literacy, health literacy here. There are 1, 2, 3, 4, 5. Okay, excuse me, just a second. Okay, so level 1, so it has like a score 0 to 225 to 500. So level 1 is the lowest level. Okay, so it's the poor health literacy skills. So an individual at this level may, for example, be unable to determine from a package level the correct amount of medicine to give a child. So this is like the bottom line, the lowest. For example, when you go to pharmacy, right? So you get the medicine from your pharmacist, and they have a written description like in how many times you have to take the medicine. So so a person with a low level 1 health literacy will not be even able to read or understand and apply that information. Level 2 is, of course, a little bit high, but again, it's a capacity to deal with simple, clear material involving uncomplicated tasks. Okay, so basically, the information is really written in very lay level, right? So anybody with a low level of education maybe understands. So so this one is a bit from a little bit better than level 1, of course. So people at this level may develop everyday coping skills, but their poor literacy makes it hard to conquer challenges such as learning new job skills. Level 3 is adequate to cope with the demands of everyday life and work in an advanced society. So this person is able to do some regular task, either it's a job or education, or do the regular task at home. Okay, it roughly denotes the skills level required for successful high school completion and college entry. Okay. And finally, of course, this is the highest level of health literacy. An individual at this level can process information of a complex and demanding nature, and and in this category probably falls like health, mostly the healthcare providers, maybe policymakers and health policymakers, researcher or scientist. Okay. Okay, so what are the components of health literacy that we are talking about? So very basic level, okay? So for example, a individual, if this person has a knowledge of their health, okay, what is going on with my health? Am I able to understand that when I am diagnosed with a health condition? Okay, or if I'm diagnosed with a health condition, do I know what do I have to, what are the possible treatments? What are the cost? Do I have access to health system? Do I have the ability to navigate the healthcare system? Okay. Also, the number two, the components is a person's ability to process and use information in various formats in relation to health and healthcare. So, in a various format, again, it could be digital health information, it could be printed, it could be verbal. So, is this person have the ability to, process this information, interpret this information, and apply that information to improve their health? And finally, is this person has the ability to maintain health through self-management and working in partnership with health providers. So what it means is self-management is like, are you able to, the information is given to, when you go to your doctor, like, they don't do the task, they don't take the medication for you. All they do is give you instructions, right? You come home and then you take the medication. And also many of the disease, for example, diabetes, right, is so much lifestyle changes. Are you able to self-manage your condition, like based on the advice given to you, okay, and like given to you by your healthcare provider? This is, I know this is not a course, but very quickly I wanted to show you there is this framework. It's called Health Literacy Skills Framework. It was developed in 2012. Just the main components of the framework, it talks about, so health literacy depends on many things. I like this framework because on the left-hand side, as you can see, the demographics, individual resources, access to individual resources, capabilities of a person. Sometimes people have mental health issues, right? Do they have the cognitive level to understand and interpret and apply this information? Prior knowledge about a health condition, that also depend on the level of health literacy a person have. In the middle, you see the health literacy skills, which are like, based on those. On the left hand side, you see those factors. Okay, those factors influence your health literacy. And then, are you able to interpret, a print literacy, for example? Are you able to read and write the numeracy information? Are you able to communicate? Like, are you able, the listening skills? Are you able to speak? Speak means, are you able to, do you have enough knowledge about this health information to communicate with your healthcare provider or other service providers? And also, do you have the ability for information seeking? And understand the e-health, for example, patient record, right? In USA, we are very advanced than in Canada. I saw in Mayo Clinic, every patient has like, access to their patient health record, and all of your history, your health history is, everything is there. All your lab result is there, all your treatment is there. So are you able to understand those information? Okay. Uh, so barriers to health literacy, there are so many, okay? So I just wanted to discuss it very quickly in this short time. Like there are many factors. These are the main, like, level of education. It could be a barriers to health literacy, okay? Poverty, of course, your financial abilities could be a barrier to accessing health information. Language, for example, if you are a country like Canada, if you are in Quebec province, all the information is, everything is in French. If you're coming here as a visitor, or there in Quebec, we receive many refugees, okay, and they come with a very different language background but may not have French. So language is a major barrier for them to access health information on healthcare services in Quebec. Disability, it could be there are people, there are patients, they have different level of abilities. It could be mental or physical. Age, if you have a young child, right, their caregiver takes care of their health, any health information given for them. So if it's a child or so, or it could be a senior person, senior citizen. So you just have to think about it. Who are your users? Who are you asking for health information? So that's very important. Ethnicity could be a barriers too. And there are many, and there are some people from ethnic background, for example, female from certain ethnic background, they are taught in a way like, you do not talk about your health. You do not ask questions about, health information, especially, female health situations, right? It's like a social stigma. So I have it, there is stigma. Often we do not think about how social stigma can be a barrier to health literacy. You simply do not ask question about your, for example, your sexual health. It's a shame, right? So you need to be aware of it as an information professional, because studies have shown that many people, especially youth, also certain members from certain communities, they use library to access health information, because they find it's a trusted source, and also they think it's a neutral, safe space for them to ask questions. So that's why it is very important as information professional for us to understand the barriers to health literacy. Don't be shy if somebody is asking a youth. Study have shown many young people, right? They go to library to ask about sexual health. So don't be shy. Like, ask questions. So that you're able to help the spectrum library users. Okay. Systemic barriers, like, it's a very common, like, access to. Don't only think about, like, North America, US, or Canada. There are countries, there are systemic barriers, right? Many people who do not have access to healthcare, so they need so much tremendous health information to manage their health. There are many other, but these are the few major ones that I wanted to highlight here. So again, the factors that affecting health literacy, again, is, for example, the knowledge of medical word is very, very, very common. What I have seen from my research, most of the online health information providers, including Mayo Clinic, of course, Mayo Clinic provides reliable health information, but much of the information is not understandable, it's not readable by general patients, like general public, because of the use of very high level of technical language. Okay, so that also affects the health literacy, because people are not able to understand the information written on websites, so they are not able to apply it. Understanding of how the healthcare system works, that also affects the level of health literacy. I mentioned it before, so I'll just go through it quickly. So ability to communicate with healthcare providers is very, very important. You have seen the both of the videos that, and also it is consistent with research findings that the healthcare providers, they do not simply communicate. It's really not their fault. In one hand, like, they're very busy, they have to see as many patients as possible because of lack of doctors and nurses in our healthcare system. So they simply do not have enough time to really spend with you and help you with the understanding your health information. And also often they talk in, like, we call it foreign language, like very high technical language. So that's also affects the health literacy. Well, of course, the fourth one, ability to find health information, which may require computer skills. As you know, especially after COVID-19, and not only after COVID-19, my research has shown in USA, I believe the number has gone up, but the last time I saw 87%, more than 87% Americans, they go online to access health information. In Canada, I think between 83 to 85% Canadians, they go online to access health information. However, not necessarily that they know how to find reliable health information. Try yourself, just find, maybe, I do not know, maybe migraine or flu, and do a very basic search. And online on Google, you'll see hundreds and hundreds of websites providing information about flu or migraine. So it is very difficult for lay people to navigate through this information overload and find the information they need. Reading, writing, and number skills I have mentioned before, it really has a direct impact. Are you able to interpret the information you're reading? Physical and mental limitations, yes, it's very common, right? As I said, many people suffer from different kind of physical and mental limitations, so that might be also a barriers or factor for health literacy. Why health literacy is important? I mentioned it in the beginning. Do you have any questions, by the way? I'm sorry, I'm talking too fast because I do not know how much time I have. Any? Hello?
About 7 minutes.
Oof, okay. I will try to finish it quickly. So why health literacy is important? To reduce, of course, health cost. You saw the cost to our healthcare system. If we are able to improve health literacy, then it will improve individual health outcome. It will reduce return visits, reduce hospitalization, and that will save money to our healthcare system. And empowerment, when people, when an individual understand what is going on with their health, that if you give them the proper reliable health information, it empowers them to self-manage their condition. Okay, so quickly, there are many strategies as an information professional that you can take. This is one example I took it from California Health Literacy Initiative. It was launched in 2003, but I really like it. So this is just to, let's say in your organization, it doesn't have to be a library. It could be any organization. You can take a health literacy initiative, and how do you develop resources? Okay, so this is like, the strategies they gave. For example, engage your audience, use plain language, clear design, focus on key message, promote teach back techniques. So I thought this framework might be very helpful to you. Now, like the main point that why, like last 40 minutes, I have been talking about health literacy and your role. I hope whoever you are here today, so maybe you have an interest to become a health information professional. So if you're one of them, even if you're not, it doesn't have to be a health information professional. Even if you become a librarian in a public library, as I have mentioned you, the research have shown that many people, like general public, they use library as a resource for accessing reliable health information. Okay, so libraries, and of course, and libraries and librarian, they have the potential to play an important role in increasing health literacy. So here are some pointers for you from me. Is that you can be a role model of health literacy. Now you know the importance of health literacy. What are the components of health literacy, and what are the barriers And as information professionals, we can contribute in each of those areas, right? Just be a role model of health literacy, and you can educate your library patrons, like how to navigate through this barrage of misinformation and disinformation, and teach them, like, okay, there are many tools. Like, one of the tools that I am developing, there are some quality criteria that which I'm not able to present it today. For example, authorship, privacy and confidentiality, readability is another quality criteria. Or you can develop your own quality criteria and educate the patrons. Okay, hey, you should use this quality criteria when you access health information online. Of course, you should promote health literacy wherever you go, either in your personal life, in your professional life. You should always promote health literacy because it saves money, it improves health outcome, and also eventually it saves life. In any, as I mentioned, any organization you work, you can advocate for building a health literate organization. Again, it does not have to be a library. Any institution, you can become a health literate advocate in your organization, or for your organization, for your users, right? Your colleagues and your users. You can take an initiative and yeah, and develop and implement, as I have mentioned uh, here, like, excuse me, like this one, right? How to develop a health literacy initiative in your organization. Okay. As I mentioned, you can create a health literacy plan. One other way you can do, say, for example, you don't work in a hospital library, you work in a public library. You can provide a list of easy to use and reliable health related website. Or nowadays every library has a web presence, like website. So you can have a section like consumer health information. I have seen it, but very few libraries do this. And I think after coming back to information science school, I'm very saddened to see we are not really contributing in this area. So I teach each of my students, hey, anywhere you go, please improve your website presence. Have a section of reliable consumer health information. And in there, you can develop, easy to understand, accessible health information. You can provide, if you are working in a county library, so who are your major users of your library, for them you can provide, okay, here is reliable health related website, you can provide them. Okay. You can partner with literacy groups, clinicians, health educators to develop easy to use health information. You can develop pamphlet. For example, if you're working in a hospital library, you have tremendous opportunity to improve health information. Okay. Excuse me, improve health literacy. Okay. um, Finally, implication for a health information professionals, please take this framework with you. Again, it's just a repetition that, develop resources to facilitate patient care for different professionals. Okay, resources, because for example, if you're working a huge academic system like University of Montreal, we have many affiliated hospitals, and each of the hospital has libraries, right? And healthcare professionals and also patients, they use those libraries to access health information. Of course, you should provide up-to-date information. This is one of the quality criteria that you should think about from today, that when you're providing health information, it needs to be up-to-date. So there is a website, it calls itself like up-to-date. So this up-to-date website, it provides latest information about medication, like all of the healthcare professionals, they use it. If you work in a hospital library, or like, for example, in university health sciences library, you must know about up-to-date website.
Thank you so much to Dr. Daraz for coming to talk with the ASIS student chapter at SJSU, and to everyone for coming to this presentation about empowering communities through health literacy. We've unfortunately run out of time tonight, but we hope that you'll continue to learn and explore in this space and check out some more of Dr. Daraz's research.